So I was asked to talk about fertility and pregnancy considerations for patients with MPN. So I discussed management of patients before they get pregnant. So oftentimes we get asked, what is the best contraceptive method for patients with a myeloproliferative neoplasm? And so I discussed, the progesterone options, which are usually the safest, and then considerations for during pregnancy, where really the key during pregnancy is to be on aspirin. And then I discussed which patients should be on anticoagulation and which patients should be on cytoreduction, and really the preferred agent for cytoreduction in pregnancy is interferon. And then I briefly discussed some postpartum considerations, including the utilization of low molecular weight heparin for 6 weeks after delivery, and then some discussion about what drugs should be administered to patients while they're breastfeeding. So for example, aspirin is generally thought to be safe. Interferon is probably also safe during breastfeeding, but there's really very little data for the other drugs.